Hi everyone, my name is Lisbeth Arevalo and I will be presenting on mortality and suicide risk in treatment-resistant depression, an observational study of the long-term impact of intervention by Brian Olin, Amara Kay, Jay Warden, Mark Bunker, and Francisco Moreno, presented in Plus One on October 25th of 2012. The observational study is about the long-term impact of intervention between vagus nerve stimulation, which will be further known as VNS, or standard pharmacological and non-pharmacological therapy for depression. The article starts with targeting interventions on mortality and suicide risk utilizing an observational registry of patients with major depressive disorder, which will be further known as MDD, and treatment-resistant depression, which will be further known as TRD. Total of 636 patients were available for an intent to treat analysis of all-cause mortality, suicide, and suicidal ideation. Treatments with vagus nerve stimulation, which is known as VNS, had lower risk of suicidal ideation. Overall, it was said that adjunctive treatment with VNS can lower the risk of mortality, suicide, and suicide attempts. The study is observational, open-labeled, longitudinal, and multi-centered. A total of 500 patients with TRD were treated with vagus nerve stimulation and treatment as usual, and 300 patients with TRD were treated with TAU and were followed for 60 months until withdrawal from the study, death, or study completion, or other study. Data collected was said to be demographic, medical history, medication history, and measures of clinical effectiveness. As for suicidal ideation, it was measured with assessments of suicidality, which is known as AOS and MADRS item 10. The rates are compared between standard treatment as usual, TAU, pharmacotherapy, where all available therapeutic interventions are allowed, and VNS, TAU, pharmacotherapy. The results found were that most patient deaths occurred at the ages of 45 to 65. SMR's measurements indicated that there are no excess of all-cause mortality in the U.S. population. Patients treated with vagus nerve stimulation and treatments as usual are said to have a more severe disease state than patients in the TAU group. The TAU group has 10 times the higher rate of suicide than VNS TAU, which is 6 times higher rate of suicide. Findings were that patients treated with VNS and TAU experienced lower suicide risk and potential signals towards decrease of all-cause mortality rate. Lowered all-cause mortality is consistent with previous TRD patient reports. Patients in the study were said to be more chronically and often more severely ill than others in previous research papers. Severely ill patients benefited from adjunctive VNS therapy by experiencing a reduction in suicide risk. Furthermore, for mortality, only a few patients died in the study, leading to adjunctive VNS therapy, and the decrease of natural cause mortality potentially influenced by the vagal system. The specific method I was assigned was in observational studies. Observational studies could possibly impact the results and discussions due to biased observational measures from the researcher. Behavioral measures can and are systematically recorded based on the person's behavior. By observing, the researcher records and interprets all patients' activities more effectively than in self-reporting and surveys. Observations' validity and reliability has to be ensured for the study purposes, this could possibly affect the accuracy of the results and discussions if not done so. Overall, observer bias can occur when observers' expectations influence their interpretation of the patient's behaviors, when then can affect the outcomes or results of the study. The study on mortality and suicide risk in treatment-resistant depression, an observational study of the long-term impact of intervention, was highly interesting and captivating. Being informed of vagus nerve interventions, VNS therapy, as a treatment for depression was new to me. I was unaware of the benefits from VNS and TAU treatments amongst people who suffered depression. That said, patients who are treated with VNS and TAU were said to experience lower suicide risks, which could help further research for accurate treatments on depression. But the authors should have explained the meaning of observational studies and effects within the study for readers to better understand the use of such methods. I think the authors do a great job in presenting their results by utilizing tables and explaining both quantitative and qualitative findings from the study. Yet as a reader, I am unsure that all the data has been fully accurate due to deaths, natural causes, and other unknown factors that prevented the full participation of participants in this longitudinal observational study. That means that some data represented in the article could contain gaps in the represented data. Overall, this research could be valuable for further investigations on mortality and suicide risk amongst people with treatments for resistant depression, also known as TRD. My references could be found below, and thank you for watching my video.